I think we'll get started. 1 minute after 2 o'clock. We'll start on time so we can finish the presentation and hopefully have some questions afterwards. Just a couple things. We'll have a couple areas within the presentation where we'll stop and ask if you guys have any questions. So on the bottom of your Zoom, there's a Q&A button. So if you have any questions throughout the presentation, please don't hesitate to fill that out. And then at the end, we'll also answer any questions you guys may have, but please don't hesitate to use that. We are going to take about a week to fill or to pick who will win free admittance to the AmSECT as a student member. And we will contact you and hopefully post that for you guys with an email. And we will start to begin the presentation. Let's see. Okay, let me share my screen. All right, guys. Well, thanks for coming today. And please, like I said, if you have any questions, don't feel free to put them in the Q&A. We want to thank you for joining us today. We're here to talk about perfusion and quality and kind of why you should care as a student. But first, we kind of want to introduce ourselves. We are the AmSECT Quality Committee. We are on here as moderators. We have Tammy Atwood, who is the Chief Perfusion at Henry Ford in Jackson Health in Michigan. She's also the Michigan State Perfusion President. We have Jillian Haller, who is the Adult and Pediatric Perfusionist at Atrium Health in the Carolina Medical Center. Jeff Chors, Director of Operations at Providence St. John's Hospital in Michigan. Ellen Hunt, who's the VP of Operations for Perfusion Solutions. And Justine Graham, Pediatric Perfusionist at Boston Children's. Excuse me. And I'm Allison Visner. I'm a perfusionist at Mayo Clinic, Arizona. Here at the AmSECT Quality Committee, sorry about that, our goal is to develop and make available valuable resources for the perfusion community, which includes like educational materials and standardized quality markers and indicators that are aimed to improve patient care and outcomes. With a vision to have this community that can use these processes to optimize patient care. Kind of working together is our number one goal. Okay, so why are we here and having this webinar? And we want to show you what the betterment and advancement of the practice may look like and how it can involve all of you guys. Because here at the AmSECT Quality Committee, we have a commitment to engaging all perfusion students to fulfill our mission and vision to the perfusion community. It starts with you guys. We want to foster the sense of community advancement in this vast field of quality and provide you with some resources for all of you to make sure yours and our future is bolstered and enhanced by each other. This is why we want to talk to you about quality. So, of course, we have to have the generic, definition of quality. So what is quality? At its core, quality can be characterized as a degree of excellence something has compared to others. Basically from what apple you're going to pick at the grocery store to what bottle of water you're going to have to, how is your house built? It's that achievement of a desired outcome or result is what we're all looking for. And they're all around us. And then the quality matters to us because it's these outcomes that what we're looking for. And it's about this outcome in healthcare that is really important to us. Because this is our overall safety, our overall health, and our overall well-being is what quality actually encompasses. And it's important in healthcare. So quality in healthcare can have many, many, many definitions. But the National Academy of Medicine defines quality as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current and professional knowledge. At the end of it, quality improvement is the framework used to systemically improve care. We must continue to improve upon ourselves to make sure the quality of healthcare is continually improving and bolstered. So how do we measure quality in healthcare? Well, we do have a couple little metrics and a couple little internal and external ways to measure healthcare quality in healthcare. But, we want to know, sometimes we want to know how hospitals can say our results are good or ensure they have the best outcomes and the best techniques. So the ways that sometimes they do it is by practice-based quality measures. These are usually internal measures that are designed by the hospital themselves to benchmark themselves. Let's say they want to decrease wounds or decrease hospital stays. These are metrics that they use inside themselves to measure, to benchmark themselves and to improve upon, to make sure that they are making good decisions and improve, and with the goal of improving themselves with it. Another way quality is measured in healthcare is by an outside independent quality commissions. One prominent one that is called the Joint Commission. Joint Commission is responsible for the accreditation and certification of more than 22,000 healthcare facilities, which is also required in most states for Medicare, Medicaid, and for a lot of commercial insurance reimbursement. This Joint Commission goes around hospitals and healthcare facilities, performing surveys or inspections of performance, quality, and outcomes that are specific for the accreditation that's desired. The JC, or Joint Commission, has standards it wants you to follow, and when they visit, they're seeing how you adhere to these guidelines, usually by tracing current or past patients' course of care to make sure that you are meeting all these metrics that they have in place for you. Now, the Joint Commission's mission is to continuously improve healthcare for public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel, providing safe and effective care of the highest quality and value. They are here to make sure you are providing that. Another quality metric in healthcare can be, basically money. I mean, quality and money kind of go hand in hand sometimes. So insurance-based performance measures equate to monetary reimbursement for hospital centers. We'll go a little bit more in depth in these a little bit later, but they can use effectively to promote quality measures in healthcare. It's usually a metric picked out by insurance in the hospital, and so if the hospital meets these metrics, then the insurance actually is able to reimburse them. Also, it's very lucrative for hospitals to meet these quality metrics because sometimes they are able to get grants from big companies. Like, let's say Walmart is going to grant you all of their employee base to do all of their cardiac surgeries or heart transplants. It's kind of a big deal because your hospital then has to maintain all these quality metrics to be able to get that contract. Another way of measuring quality in healthcare is by participating in national registries. Participation in these registries can help showcase areas that your center may be excelling at or other areas where you may need a little help. And then they're able to provide resources to be able to improve upon the quality in your hospital system. So quality. Now that we've talked about how quality in healthcare is always evolving, do you think quality improvement has happened in perfusion over the years or in cardiac surgery? Have we improved upon ourselves in the last 10, 20, 30, 40 years? I believe that most of us would agree that advancement has happened and got us to where we are today. And as students, you fill your day studying, classwork, and soon working at rotation sites. I'm sure at this point you're asking yourself, why should I care about quality improvement? I have so much going through my head every day. I mean, my stepson right now is going through perfusion school, and I see him just intensely studying and improving upon himself every day. And it's that quality in himself that he's making himself a better perfusionist, but you're doing it every day. You're working on the quality of perfusionist you are every day. And why not take it into your practice that you're at right now? We could be learning about, how to assemble and operate a bubble oxygenator or heart-lung machine, or learning how cross-contamination works. And this could be our practice today, but it's not. We're learning about those in the past of what brought us to where we are today. But today we're on the advancement of almost AI systems and systems that are mobile and that we can take different places. And it's really amazing where we've come the last couple of years through our advancement and quality improvement. And as a student, we feel this is a good time to start talking about where you fit into that. Like I said, presently, you all provide a fresh and new perspective because everything is so new to you and so just exploring everything. You're learning about everything, you're exploring everything, you're asking these questions that maybe we haven't thought about. And we just ask, maybe you listen to yourself, whether it's during class or going out on rotations or your first job as a perfusionist. Each one of those scenarios will allow you to be inquisitive and listen to yourself and take possible questions and concerns to heart. Some possible questions and concerns could be like, do I understand what's in my prime? Do I understand all the components in there? Do I understand why this temp management is better than others? Do I understand that what this practice that I'm working in or my rotation site is doing what's best for this patient? Now, it's not for you to say that they're wrong or right, but it's for you to question and then maybe put forth something that could look like a quality opportunity to make improvement upon. Because we are advocates for our patients that we are taking care of, and we are accountable for our own practice. Now, AmSECT speaks about this responsibility that we have about being accountable. This responsibility is written into AmSECT standards and guidelines. AmSECT Standard 17 says the perfusionist shall actively participate in both institutional and departmental quality assurances and improvement programs. So this includes everyone, from everyone who's actively involved in the perfusion community. So now we've gone over a little bit of stuff. Does anybody have any questions? Oh, whoops. I think I have to get out of there to. I can't see if we have any questions. So if any of the moderators see we have any questions, just let me know.
Currently, we do not.
Okay. Well, let's continue. So, as we said, listen to yourself, ask questions. The biggest thing is you are learning so much and taking so much in, and we don't want you to get overwhelmed. The biggest thing is taking small steps, and being comfortable. Maybe you are wondering about the correlation between cardiac surgery and renal function, but that's a huge topic to take on. Maybe we try taking it down into smaller pieces. Those smaller pieces are what are going to get you farther on and maybe be more successful. And so small wins, those small successes of either educating yourself, educating other people, or finding quality improvement that you can suggest and maybe work on along the way. So now let's talk about how you get involved in all of this. And the simple answer is to start investing in quality practices and find a way to improve your own practice. But I guess, like we said, you're a student and you're probably doing that every day, trying to improve your skills and knowledge and eventually provide the best care you can for your students or for your patients. But a great way to start working towards quality improvement and answering these questions that you have is maybe participate in the plan, do, study, act cycle. So this is a process improvement that is usually a cycle that's commonly tool used in healthcare to utilize and improve quality change. Now there's many steps and many ways to do this, and this is just a suggestion. So, you guys can research different ways on how to do this. But the plan starts with a plan. You devise a plan. You develop a plan in which your objectives are clearly defined, which is where you state the who, what, when, where the plan is to take place. What do you plan on working? What strategy do you plan on taking? Talk with your resources that you may have and see what permissions you might need to be granted before you start working on your plan. Next is the do. This is where you're going to implement that plan or change that you talked about. This is kind of the fun part. This is how you're going to practice. This is what you want to do in your practice. Next, study. You want to study your results. You want to put together your data, enlist help from other people, and analyze the data that you've collected. So you can start to understand the impact of change and possibly identify something you need to change during this process that you're in. The next is the act. You're going to present your findings to your team members, and based on your findings, you may act to fully implement the change, make adjustments, or scrap the current plan altogether and just start over. But the best thing about this is that this is a cycle. You can continue to do it over and over again and revise and redo and re-edit until you know you've been successful in what you're trying to plan. But this cycle allows you more than one use of the cycle. But let's find about resources though too. I think this is one of the biggest things that was eye-opening to me is the amount of resources that are available to not only you as a student, but when you start going into rotations and as a perfusionist in general. One of the biggest resources you have right now is your school. As you can start looking at your school and start talking with your professors and your administrative staff to see if they have any potential resources or opportunities at your school to join in any research projects and just the beginning of where you're at right now. There's probably various research and quality improvement projects to participate in and around campus everywhere. I know that I was involved in one, and we had a poster presentation that we presented at AmSECT when I went through school. We worked with biomed students and were able to come up with our project together and really band together and make a great poster out of it. But also inquire about what research databases your schools might have. All of these could be put you on the path to success. A lot of these schools are, resourced with hospitals and other things. And your school has all these different students in different departments that are just looking to collaborate with you guys. Another great place to get involved is during rotations, once you start going out rotations, and even when you're as a perfusionist out there. The amount of resources that your hospital have is usually very abundant. I would start by trying to join in on invited meetings. Even when I was a student, I really tried to get on as many meetings as I was invited to. A lot of times you have to make sure you're invited. But hospitals and departments usually have like weekly, bi-monthly, quarterly meetings concerning different departments and work groups. It's easy to get involved with these groups, and most of the time you just need to show interest and initiative to start attending. Remember to always ask if you can attend, but these meetings will offer insight about how cases are scheduled, how practices are run. And in most meetings, different types of quality metrics are also discussed. It could be an M&M where they're discussing that patient that has passed and if anything that could have been done differently, or discussing how better to identify kidney dysfunction for emerging new research and technology. The list goes on. I mean, there's so many valuable meetings to attend and participate in. There's not only your regular, what you see is CTS meeting, transplant meeting, blood bank meeting, VAD meeting, ECMO meeting. There's also usually a subset of research meetings. Your hospital library also usually has a great resource. The librarians in there are just a wealth of knowledge to help you find anything. And some hospitals do actually provide statistical and data managers that actually help you. Like I know we're heavily involved in our VAD meeting, and we take all of our numbers that we want to see and we give them to our data manager, and they're able to generate this huge spreadsheet for us to keep track of all the metrics that we want to keep track of. It's a great way though. Once you get involved and you show this initiative, you'll be invited to so many things. So another good resource is utilizing the national databases that we have. Now, national registries are very helpful. They work by accumulating data and information from agreeable and voluntary participants and turn out results and outcomes which we benchmark ourselves in our practice. Now, one that some people directly have to fill out paperwork and do the STS, where a lot of things are just kind of entered in the background using our data that we have done over bypass and cardiac surgery. One of those is the Society of Thoracic Surgeon National Database, known as the STS database. It was launched in 1989, and it's a comprehensive collection of clinical data used to improve quality in the care of thoracic surgery. It's a critical tool for surgeons, hospitals, researchers, us. This is a voluntary registry and is known as being a gold standard for quality improvement and patient safety in cardiothoracic surgery. Like I said, even if you think your hospital's not participating, I mean, they are. They usually have a team in the background that's collecting all the data from length of surgery, what type of surgery, everything you can think of. They're documenting it and entering it into this database. This database is stated to roughly capture about 95% of the adult cardiac procedures out there. All that data that's collected is de-identified to protect the patient privacy. And to date, they state on their website that they have nearly 10 million procedures in their database from nearly 4,300 surgeons. So it is a huge database. It's used to provide many providers to measure the quality and patient care and outcomes. And participating in this practice can be changing for some doctors. You know, they use this database to provide a multitude of just research projects that help within your hospital for improving like procedurals that they do, different kinds of procedures that they do, different ways they do it. You know, it's a collaborative for other people to work with. The STS also breaks down all of its information and has more specific databases and sub-registries. The main one being, of course, adult cardiac surgery, then general thoracic surgery, congenital heart surgery, INTERMACS and PDMACS, which covers pediatric and adult patients who have received mechanical circulatory support. Of course, hospitals always get audited to make sure that they are self-reporting correctly. You know, they just don't want people that make their data look really good. So they look really good on the national database. They want to make sure this is being reported correctly. As previously stated, our professional society of AmSECT states in their standards and guidelines that we should be collecting and reviewing data, which is why AmSECT supports Perform as its national perfusion registry. Perform is a quality improvement registry that is created perfusionist by perfusionist. It's a clinical registry that exists to collect data concerning the practice of bypass and surgery. It's accomplished this by collecting data from every case from participating centers. Again, this is voluntary. You have to make sure you have to be a participant in it and then voluntarily fill these forms out. The data includes everything from circuit size to anticoagulation methods to times, drugs, and so forth. I mean, it really does all encompassing. We just started this about a year ago, and I do it during my case, and it takes very little to no time. It's very extensive, though. The questions that they do ask, it covers everything. An important benefit of Perform is that before participating cardiac centers submit to the STS, the Perform data is audited with the cardiac data to verify that all the information being submitted to Perform and the STS is the same. The Perform to STS match will hopefully allow for good data going in and bad data going out. You want to make sure that the perfusionist and the STS, that information that's being submitted is the same. So it's a perfusionist responsibility who participate and Perform to make sure the collection form is filled out correctly and sent out to be collected into the database. By putting in the work and time after each case, you can go back to the database and review various metrics and break it down from certain parameters like procedures, fluid management, transfusions, AKI. You can see what other centers are doing more of or less of, or what equipment they might be using, how they might be wrapping, what they're wrapping. It's a very interesting database, and I've really enjoyed having it this last year. So here's kind of what it looks like, what you'll get. You know, just each center will be given a number, and because everything's de-identified, the centers are de-identified, the patient information has been de-identified. But it's kind of neat because, you know, like let's say you're number 18, well, you're just kind of in the middle. Cases performed with wrap. But then you're 7 and 4, you can be like, oh, wow, that's quite different. And what is really interesting is like over here we have percentages over here, 0 to 100, and AKI, acute kidney injury. Well, if your center's over here and this black box, and you're having a higher incident of AKI, and these centers over here in the red box have a very low incidence of AKI, maybe you can kind of consult with them or see what they're doing to help you move your box towards the lower percentage of AKI. So what Perform does is it just tries to, you know, really have people work together and collaborate to make for better make for make for better policies and procedures to really benefit the patient. So as of 2023, they had 45 hospitals in 16 states, 120 surgeons, and 208 perfusionists, but they are growing and growing every year. Like I said, the number one goal of participating in a database is to bring awareness, collaborate, and learn from each other and not be punitive. It's how we all can do great together. So another way we use quality is trying to prevent something bad from happening, of course. That's the goal. We always want to prevent something bad from happening. You know, we are worst case scenario thinkers. We want to make sure we've thought about everything before we go on, before we take care of the patient. We want to make sure that we've just covered all of our bases. But prevention, and kind of like how airlines have a black box to record all of their good and their bad things, well, we have PSOs, which are patient safety organizations, which are entities that collect, analyze, and provide feedback on data that's voluntarily reported by healthcare providers. Kind of like healthcare's black box instead of the airport or airline. These PSOs collect data given by healthcare workers. Most of the time, it's items reported are near misses or catastrophic events, but it's the information given by healthcare workers that they want to see maybe corrected or changed or given so we can gain knowledge from it. The good thing is that PSOs and the information that's given by healthcare workers, usually anonymously, is authorized and protected under the Patient Safety and Quality Improvement Act of 2005. It provides legal protection for healthcare providers by allowing them to report patient safety data without the threat of information being used in lawsuits. So it encourages people to be more open and honest with reporting without worrying about being punitive, without coming back to them. These PSOs also collect patient safety data from healthcare organizations, hospitals and clinics. They analyze trends, identify risks, develop strategies to reduce harm. Could be medical errors, medication issues, falls, other things like that. But then the PSOs offer collaboration and facilitate this between different healthcare organizations, usually allowing them to share information, the best practices, and safety improvement. Therefore, working to increase transparency with healthcare by ensuring that patient safety information is shared in a way that supports improvement while protecting individual and institutions from legal liability. So there's both national and regional PSOs, and they're all accredited. If they are accredited by the U.S. Department of Health and Human Services. The organizations vary, of course, in terms of services they offer. But in summary, PSOs can play a crucial role in advancing patient safety by creating a safe environment where healthcare organizations can share information, learn from each other, and take steps to reduce harm. So, as perfusionists, though, we have ORM, which is great. ORM is AmSECT endorsed and is a perfusion-centric patient safety organization, which is the first and only perfusion-centric PSO in the world. And it's endorsed by AmSECT and accredited from the Department of Health and Human Services. So ORM provides that safe space for us to report these near misses, non-routine events, and possible patient harm incidences, which is great. I mean, we want to have that protection that other PSOs have. So in reporting those incidents, ORM provides protection to the person reporting, provides analysis information and feedback from the information that's gained. And this is from the ORM website. It believes that it may assist in the development of national standards and guidelines, in part by using empirical experiences. ORM believes that the aggregation of data from a large number of incidents could assist in understanding what safety initiatives are working and which ones might need revision or redeployment of resources. Kind of sounds like the PDSA cycle we were talking about, like you keep starting over, and if it doesn't work, you redeploy. Benefiting perfusion community as a whole. This could also change industry standards from change in practice to the change in equipment that we use. I mean, this is practice changing. This could change our practice from where we start in the morning to where we end at night. So there is a membership to ORM, but there's also has its own incident reporting that's online, and it's completely anonymous. And it's on their website. and the data received is processed, and then it's used in the development of, like I said, best practices, improved patient care. It also can be used by manufacturers to ensure that what they're doing best for patient safety. So this reporting is very free and anonymous, and anybody can do it on their website, perfusionsafety.org. So now we have to mention AmSECT because we love AmSECT. So AmSECT in this discussion, and now we want to further dive into AmSECT as a great resource for you as a perfusionist and a student. AmSECT has provided us and continues to update, modify standards and guidelines for perfusion practices in adults, pediatrics, MCADs, mechanical circulatory support devices, and they're all found online on the AmSECT website, which is free to use when you become a member, which you guys all should be AmSECT student members. For example, the pediatric population quality requires special consideration and tailored approach. The one size fits all approach isn't the best option providing care for all patients. For example, the size and makeup of a circuit prime is incredibly important consideration to pediatrics because pediatric patients have smaller circulating blood volumes. So look here, the pediatric standards and guidelines provide recommendations for the best way to provide that quality of care regarding, circuit size, makeup of prime, everything you can think about in here, from circuit size to shunts to prime compositions. It really is a wealth of knowledge just circulating into the AmSECT place. Sorry, one second. Dogs I didn't know I had. Sorry about that. My son's dogs. So we would like to share how the entire state of Michigan was able to use these AmSECT standards and guidelines to move forward to safer practices for patients. In Michigan, there's a collaborative called the MSTCVS. It's the Michigan Society of Thoracic Cardiovascular Surgeons. And here you can see there's a triple town map of people involved in the collaborative. This collaborative is made up of perfusion surgeons, anesthesiologists, data managers, and others. Because this is collaborative, each subgroup has their specific topic, of course. And under adult cardiac and congenital, you will see Perform Perfusion Registry and the Michigan Perfusion Society. Yes, the perfusionists are a big part of the collaborative, and it's one of the biggest things they have to contribute their data collection registry Perform, which has been beneficial in many ways. Can you imagine all these surgeons, perfusionists, and anesthesiologists working together? It's kind of like a perfect world. But how do you get everyone to participate and show up together and work well? I mean, just because everyone's invited doesn't mean everyone's going to show up. And we all know how virtual meetings sometimes get pushed to the wayside. Well, when you involve money, money starts helping. Hospitals need money to keep the lights on, and insurance companies prefer to save money. It's through these two mutual wants and goals that we have something called pay for performances, something we talked about earlier. These pay for performances are predetermined metrics that allow for the insurance companies to reimburse a hospital. So they're metrics that are put upon the hospital, probably by these insurance companies. And then once the hospital meets them, they're able to get reimbursed. Well, one of these pay for performances supported by Blue Cross Blue Shield is for members to regularly attend the Michigan Society of Thoracic Cardiovascular Surgeons Quality Collaborative. And so they do. This pay for performance came from the question of how best to make sure each institution has a representative attending the quarterly state quality collaborative meeting. Because Blue Cross wants their practitioners, surgeons and perfusionists, to continue their education, collaborate with peers, and strive for best practices. And the hospital wants their employees to practice the best practices. So this provides a win-win. So that's how they got everybody to participate and really show up to these meetings and collaborate well. Well, during one of these meetings, I skipped over. So first of all, this is how we got all these people to work together. And perfusionists came up with this idea of like, hey, we'd like to put forth this best practice. The AmSECT standard guidelines number 12 for protamine and cardiotomy suction says cardiotomy suction shall be discontinued at the onset of protamine administration to avoid clotting with the CPP circuit. This sounds simple, right? We can suggest this during a meeting that this might be one of our process improvements, and people will just jump on board, right? Well, these is kind of right. The perfusionists in Michigan were able to use this perfusion data collection registry perform in collaboration with the AmSECT standard and guidelines to push for quality improvement through best practices. The Michigan Perfusion Society felt strongly that this should be a standard for all hospitals and practices because they have this tool to support us professionally, they are able to convince the insurance company Blue Cross and Blue Shield that this would be a good value-based reimbursement project to improve perfusion safety and prevent adverse events. So they use this standard of care from AmSECT to promote a value-based reimbursement. So what do you think happened? Well, it's quite impressive what happened. And the gray dots is where centers started. They represent where each institution was before the QI project started. Of course, there is a variety of practices, and the blue dots show where each hospital moved by the end of our project. It seemed a huge success. I mean, look at this center went from less than 10% to almost 100%. And when they got over here, it was widely accepted, except in a couple places, but even those places had made quite a bit of improvement from where they started. So through this collaboration, institutions who were already following the standard also became great resources for those who were not following the standard and became something to strive for. This is using data for good. And because of quality improvement is a team sport, we can achieve more working together. Now, your team can look like a multitude of things, but know that there's resources and people out there to help you, and all you have to do is ask and get involved. Like I said, they can vary from team to team, but they could include perfusion advocates, physician advocates, data managers, statisticians, anesthesia associates, mid-levels, RNs, techs, etc. Because reaching out to other professional groups within and outside your team can help bring awareness to each other's goals and how to be successful. And you might find shared interests and targets for better quality projects. Simply, you need to communicate and work together. I remember when I was a student doing a rotation site, I partnered with the perfusionist who partnered with the anesthesiologist in the lab, and we did a project together that got written up and public written up, and it was in perfusion. But during that procedure or that quality project and that research project, I got to know so much more than I would ever know, and meet lab people and learn how to communicate with them and know that everybody in the hospital could be your friend and really wants to share their knowledge and really wants to help for the betterment of all medicine. So, why is this important to you and of you guys? I want to know, I know you guys are just students, but it's important because we're all here for the same goal is we want to help people. We don't give up our birthdays and weekends and holidays to not help people. This is one of the reasons why we came into this profession is we all want to be there for the betterment and advancement of our practice and promote safety and quality and outcomes. This enhances or adds value to our field. It gives us recognition and, does have a little bit of job security asked to it. And sometimes it does, increase our value, basically. But the important thing for all of you to know is that we all need to get involved. We all need to show initiative. When you go on rotations, when you're at school, there's so many resources to be around. All you have to do is show initiative, be able to take in, and like you're gonna get from what you put into it. So you just have to see what you want out of it. So are there any questions, moderators? No.
So we've been kind of typing answers as they've been
Okay.
filling in.
Okay. That sounds great. Well, the last couple minutes of our presentation, or the last half of our presentation, we're going to talk about student AmSECT membership. Now, We hope that all of you guys are student AmSECT members. It's a great way to start your career in perfusion by being involved and joining AmSECT, especially while you're a student. There's a lot of perks for it and involved. But joining a professional society is pretty uncomplicated, comes with some great benefits. But for students who want to get more involved, we have the Student Involvement Committee. Now, Student Involvement Committee is a group for students run by students with perfusion oversight. So picture here the co-chairs of the student committee, Keith Bryant, who's a great guy, perfusionist who works at Mayo Clinic in Rochester, and Danielle Nguyen, who is a perfusionist who works at Lucille Packard Children's Hospital. These gentlemen are very serious about helping students and provide a great resource. Now, what is the Student Involvement Committee? Well, Student Involvement Committee is a subset of the AmSECT student member who wants to be involved and participate in a professional society. They are current students from around the country who virtually meet once a month. During the meetings, they discuss ongoing responsibilities and talk about potential projects. So here you can see the 2024-2025 student council members, officers. It's governed internally by a student council. All members of the Student Involvement Committee are part of the council. So don't think you're going to join and you're not going to have any kind of involvement or responsibility, you know. But like I said, what you put in is what you get out. But during this meeting, they discuss ongoing responsibilities, talk about potential projects. They work on a lot of fundraising projects. You can see here a couple years ago, they designed a t-shirt that they sold to raise money. They also design student scholarships. And they also, like I said, fundraising projects. Another fundraising project is in 2023. AmSECT Steel Council kind of designed this heart walk from cross country. They participated in a 3-mile walk in their wherever city they were in, and they got not only student council members, but they got perfusion students as well as other perfusionists to participate in this. And they were able to raise $2,300 to sponsor student attendance for the AmSECT 67th conference in New Orleans. They provide surveys to make sure, you know, schools and other resources are meeting your needs. They also publish a bi-yearly student newsletter called AmSECT Tomorrow, which has, you know, varying topics, but the newsletter is geared towards those individuals who are still in school. It features a variety of information, tips and tricks, you know, like how to find housing on rotations, book reviews, section about goofs and blunders that students have seen or done rotations. Believe me, you're not alone. Everybody has those goofs and blunders. And interviews from current perfusionists or other people from the cardiac field. It's kind of a neat resource to have and just read through, especially as a student. But getting involved in the Student Involvement Committee is really great. It can really benefit you from networking with other students. You know, you can have student discussions. Like I said, you're not alone. It's being a student, it's really nice to have a resource, kind of a group therapy, to know that everyone's going through what you're going through. You can also find out more scholarship and fundraising opportunities for you guys, information on clinical rotations, you know, from what to expect in your clinical rotations, to maybe help in like possible information about housing or transportation during your clinical rotations. And Keith and Daniel help with interview prep and resume prep. And so they have a whole way to help sit you down and make sure, you know, go through the interview and make sure your resume is prepped and ready to go. It's just a great way to start getting involved in professional committees. So, you know, this is your profession. It's important that you get involved and you stay involved, you know. And how to get involved? Well, become an AmSECT member. I still believe student membership is free, not fee, but it is free. You just have to sign up. And then if you want to be more involved in the AmSECT Student Involvement Committee, just email the AmSECT student headquarters at gmail.com, or email AmSECT, or go on the AmSECT website and there's the AmSECT Student Corner, and that will give you all the links that you need to get involved or get in touch with Keith or Daniel. And Keith or Daniel also told me to tell your program director if you want to get involved, and they'll find their direct email if you really need a different way to get involved. But, you know, it's just a great resource to have, and it's available to you. And, you know, just being involved is one of the most important things in perfusion, is, kind of getting your hands dirty and just helping everybody out. But I think we're done now with that. Let me get my screen sharing off. Oh, here we go. And I think that's kind of it. We have a little chat here. Oh, there it is. Yes, and Emily put it in the chat, the AmSECT student corner right there, which is kind of nice as a resource for anybody that wants to get involved in the student involvement committee. So does anybody else have any more questions at all? How'd the Q&A go, guys?
Seems like the Q&A went very well. I just want to expand on a question that Cameron Harper put out. As a student, it can, and it was already answered, so I kind of want to comment on it though. It can be hard as a student to suggest an improvement quality to preceptors. Don't we know that? Going back from my student years, I mean, if you kind of looked at somebody wrong, it was not a good thing. So I can understand that students really want to focus on, learning, and that makes good sense to me. But the question here is, what is your suggestion to introduce an improvement quality despite going against the way they've always done it or without coming across as a know-it-all or questioning their skills? As a student, I always say to our students, yeah, it's a fine line to navigate how you come across to your preceptor, to a department. But I always tell students that it is never a bad idea to phrase anything in the form of a question. After all, your students, that's what you should be doing, is asking questions. So if you can find a way to ask a quality improvement question as opposed to a statement, that's always good. The other thing I want to suggest, and why we're presenting a quality program here, is, and I don't know, maybe some of the other panelists would disagree, I'm not sure, but we want to get you thinking in a quality improvement regime. It really isn't our goal to have you as a student start driving data conversation. It's not bad to drive a data conversation, but the expectation is that you're not going to implement a quality improvement project as a student. But what our hope is that this will be a seed that we plant, and that as you go into the employment arena, that you look for a function, you look for a way to bring value added to your department. And one of the things that you can do when you're an employed perfusionist is indeed make a suggestion for a quality improvement project or get involved in your department that way. So what we're really hoping to do is stimulate and encourage an opportunity for when you are placed, when you do pass your boards, when you want to make a contribution and add value to your department and to your patients, that this would be a way that you could do that. I'll tell you what, as a family member of someone who's had heart surgery, you look at things a lot differently when you're sitting in the waiting room, waiting for someone to come out and tell you how your loved one's doing. And you start thinking, geez, did they use this? Did they do that? Did they? So what we're hoping to do here is plant some seeds, and through that, give you guys an opportunity to engage in quality improvement in your career. I am amazed with data. I mean, anybody who's a baseball or athletics fan, they have had statistics in athletics for centuries, for decades. And people can tell you batting averages and scoring tendencies. I find it interesting that in healthcare, we're kind of trying to catch up here. And I think this is a great opportunity to catch up, drive standards and guidelines, and make a difference.
I think that's a great analogy, baseball and statistics. When I started my career too, I didn't want to get involved in much. I had just learned for 2 years. But, starting small with Excel and looking at results started kind of motivates you, just making those small changes or small, like you said, small steps when you come into an institution can start the momentum,
And as a panelist, well, we've driven quality at our organization. I'm fortunate to be in Michigan and to be a part of Perform and to really collaborate with surgeons, anesthesiologists. And I think some of these quality improvement projects, a sidebar, is to not only get everybody involved, but get everybody talking and functioning as a team. And what's really impressive is that you can accomplish a lot as a team. One of the things that this particular panelist was really impressed with is we, for 2 years running, have had a glucose initiative in the state of Michigan. With that glucose initiative, our goal is to keep the glucose below 180, 179 or lower for the entire operative course. And the first year it was cab only. And the second year it was all comers. And I have to tell you, one of our institutions, we failed. We missed it by 2% the first year. But I'll tell you what, we exceeded the goal the second year. And what it did do is it got anesthesia, perfusion, surgeons talking about how we're going to manage a patient's glucose right from the timeout to the debrief. And I think it makes a big difference. We've run a lot of different quality improvement projects, protamine suckers, temperature management. And one thing it does do is get everybody talking. It gets everybody, at least the goal is to get everybody engaged.
Allison, you're muted.
I saw that. I want to say, guys, thanks for all these great questions. I'm just kind of going through them right now that I can see them, and I appreciate everybody. I'll have to maybe add some of this to our presentation too, to make sure we cover everything. And if you guys feel that we could cover anything better, or any directors out there feel like we could add something to it, please don't hesitate to email. I think I emailed pretty much everybody I could. We are doing this presentation again next month too. February, Tammy, what day is it? 11th?
I believe it's 11th, yes.
Yeah, it's February 11th. So anybody that missed today, we will be doing this again February 11th, and hopefully make this a yearly thing. And we really appreciate everybody really coming and participating today. So anybody else have anything else to add?
I just think this is a great opportunity for everybody to get involved, even the staff perfusionists. And I think as students get employed, as they look at these as an opportunity, I think engaging the entire department and doing something department wide, in essence, I think you can really have the tail wag the dog here. But it does take passion, and if you're looking to make a difference, I think this is one opportunity where we can really kind of hit home. And it can be not only driven from standards and guidelines and procedures, but I think reporting and really dealing with safety is another issue. And I think when we start looking at some of the instances and variances in practice, I think this is something that we can clean up. I can tell you when I take my car in, I get it back, and whatever I took it in for hasn't been fixed. I can't tell you the dissatisfaction that I have with that, or the dissatisfaction with a poorly cooked meal, or, and think about this from a family's perspective. To have a surgery not go well because, you know what, we haven't followed a standard and guideline, or imagine the disappointment on the other end for a family receiving that their family member has an additional challenge that they now have to get through. So the importance of what we do, the ripple effect of a drop of water hitting the lake, I can't tell you the contributions that all of you guys are going to make in your careers. If you better one person, imagine the impact that has.
Thanks, Jeff. You're 100% right. I don't think I think everybody understands, but the impact you guys are going to make is it is life-changing every day. So, and it's very important to make sure you are being safe and protecting those people you're taking care of and being an advocate. And participating and getting involved helps with all of that. So, thanks, guys. hope everybody has a wonderful afternoon. And I appreciate, thank you moderators for helping me out today. And we hope to see everybody at the AmSECT conference. All right, have a great day, guys. Thank you.
Thanks.